Hello, Team Survivor and Team Farmers. Welcome to my storyline. This is my breast cancer survival story. Allow me to share with you my clinical journey towards recovery and survival. 23 years old pa ko ato nga time when I had my first minor surgery. Left breast for a solid mass removal. It was classified later after the operation, after all the laboratory, after all the tests. It was classified later after as a fibroadenoma. Um, the surgery was performed at a certain hospital here in Mindanao. Um, the first surgery was it was successful, pero later na ay na found out nga gitawag nila post surgery, sorry, post surgery complications. And I am scared that time, as in kuyba kaayo, because bata pa man ko, I don't have any information about even my situation about lumps, breast lumps, or breast mass, or anything, wa ko'y idea ana. And then, to make the long story short, ang surgery, katong akong giingon ganina na asizay complications. I am really scared at that time. My wound got infected and I was scheduled for a resuture to clean the infected area. So another na po siya nga operation, another sakit. For me that time, it was my second. Now, 3 years later, in 2001, in the same breast, fine needle aspiration or FNA was performed on me by a surgeon from Cebu Doctors University Hospital, Cebu City. The question sa imong tanah taon sa maning FNA. FNA is a breast fine needle aspiration that removes some fluid from the cells from a breast lesion, a cyst, a lump, sore, or swelling with a fine needle similar that used for a blood test. Kanang kuhaan kag mga blood sugar, something like that. Basta kanang gamay lang siya. And then, the sample of the fluid or cells or tissue is examined by a specialist doctor as a cytologist, called as a cytologist rather. An FNA can assist the doctor to determine the nature or diagnosis of a lesion, or if necessary to plan treatment. Parehas gibuhat sa ako. We need to work it out like that para makitaan if it needs further treatment or something like that. Mo na ang gibuhat sa akong left breast. Then a few days later, minor surgery was performed again in the same breast. Then the biopsy result came in a few days later, where with a clinical assessment na the same atong first and second nga fibroadenoma. First rather, a fibroadenoma. Ang fibroadenoma this time is a lump. Gitawag nila as a lump uh, in my what you call this klarohan na to. Ang second surgery na ay nakitaan, then the test showed, the result rather, nga fibroadenoma. It is a lump in my breast and can be a scary experience para nako, but not all lumps manggod, o dili tanan lumps and tumor is called fibroadenoma though. Mo nang fibroadenoma still require treatment according to my doctors. My fibroadenoma has a BI-RADS category of 2, which stands for a benign findings. So far at that time, I am okay health-wise. Fast forward to April of 2008, another surgery in the same breast, my fourth this time. Results show that time as focal ductal ectasia left, but still benign findings. I was quite worried then since it's within the ductal area. Ductal area kana bang agihanan o gatas sa atong breast sa mga nanay sa female. By the way, prior to every surgical procedure, the SOP that time is I had to undergo two laboratory procedures, the bilateral mammography and the bilateral sonography, or kanang gitawag nato nga kanang sonography ang gitawag nato nga commonly called as kuan breast ultrasound using a high definition sonogram, and every after operation we had to send the specimen sample dito sa assigned pathologist for biopsy. Now, after my surgery that month, my surgeon, who is a soft tissue specialist, advised me to advised me for a repeat high definition sonomammography still at Cebu Doctors University at their Women's Center. November of the year 2008. That was November of the year 2008. The same a clinical assessment and recommendation showed a distinct solid mass na po siya bugon nakitaan. The same bugon with suggestively benign sonographic features bilateral. Short-term follow-up after 6 months by sonography is suggested to monitor stability. Simple left and separated cyst, right cyst, focal ductal ectasia left. So duhay nakitaan na ako'y cyst diri sa ako'y cyst, simple cyst diri sa left side. Then na ako'y sa right side simple separated cyst, and then sa left side nako napoy nakitaan nga focal ductal ectasia, which is the same nga nakitaan the previous operation. With BI-RADS this time, the difference kay with BI-RADS category of 3. Last time it was BI-RADS category of 2. This time at 2008 it was BI-RADS category of 3. Probably benign finding, short interval follow-up is suggested, and I was scared of the term probably benign. Kay nga naman wala kanang the term benign is dili kanang giingon ba probably dili sila klaro, it's not sure. So that's what I'm scared about. I'm not quite sure with the findings and even the doctors. So then 9 months after that undergo na pod ko og another laboratory exams exactly August 27 of 2009 to be exact ana nga day. Then I had my bilateral mammography and then the same high definition sonomammography with almost the same findings sa previous nga laboratory 9 months ago. That time the same findings from the earlier laboratory exams: focal ductal ectasia, left breast with a BI-RADS category of 4. Sa akong napanidaan, every year nagkataas ang BI-RADS category. So this time, from previous 3, karon na 4. BI-RADS category of 4. Meaning, there is a suspicious abnormality. Biopsies should be considered according to my radiologist, with a clinical assessment and recommendation of an irregularly shaped inhomogeneous solid mass with suspicious sonographic features medial left. The tissue correlation suggested, tapos precautious core biopsy may be done daw under sonographic guidance with an advice or suggestion. Then lagi sa result, out from the result. Then September of 2009, my fourth what we call this, my fourth surgery. September of 2009. Exactly my fourth surgery. Now, unsa may that time unsa may nahitabo ato nga mga time medyo lisod-lisod. Di na ako madawat tungod kay sa ka-short sa time. nga nagsunod-sunod ang mga clinical laboratories, mga kakulba. Then, again, way back September of 2009, my fourth surgery, biopsy was done with a diagnosis, this time lipoma na. Previous is fibroadenoma, this time is lipoma. Now, unsa man ning lipoma? What is lipoma? A lipoma is a benign tumor. Tumor na siya karon nga time. It's a benign tumor or a breast of the breast, meaning tumor but tumor siya pero not cancerous. That time I felt nothing, but still I am religious enough to go through with my annual mammo and ultrasound. January 13, 2011, exactly 1 year and 4 months after my fourth minor surgery, after my what do you call this? After my fourth minor surgery, ang nahitabo ana is another na pod nga time where hadlok na pud ko. Kay, you know what? Every time I have to undergo laboratory exam, it's quite scary for me because I'm afraid of another development or something might went wrong. So, lisod, it's mixed emotions. Again, 1 year and 4 months after my fourth minor surgery, needed na pod nga i-undergo ko again og bilateral mammography and high definition bilateral sonomammography. To make the long story short, results showed and BIRADS category of 4A. Last time 4, this time 4A. Again, another suspicious abnormality. Need na pod og biopsy since nag-increase man ang diameter sa solid mass. So, fifth surgery was performed. A week later, the lab results came in. Then, biopsy showed it was what you call this, a fibroadenoma. So, last time in my fourth, lipoma. This time in my fifth, it's fibroadenoma. Again, annual laboratory tests have been performed since my last surgery in January of 2011. Then, a year after, then 2012 laboratory showed good results sa gikan sa 11, 12, 13, because yearly I have to undergo a laboratory yearly, mammogram and sonomammography. Then, but only in July 11, when was that? No, not 11. But only in July 2013 kay 2011 free man ko. There's no complications. July 12, 2012, there's no complication. So, only in July 13, laboratory test results came in. Na pod ato nga time, it's quite surprising. Quite surprising because there's another increase in diameter as to my left breast, mass sa akong breast. Kay wala man to totally remove, nagkuha lang man og portion para mabiopsy, but the mass is still inside. So again, since there was an increase of diameter with my July 2000 diha nakita sa July 2013 laboratory, again a minor surgery was performed. Mao ni ang akong sixth breast surgery. Then, as to the biopsy results, it was confirmed that it was lipoma. When I was advised by my doctor to have a follow-up check-up, a repeat laboratory examination, ato nga time, niyon si doctor nga, I have to see him again by May 15. By May 15 of 2014, ana among next schedule. So exactly 10 months after the previous surgery, exactly 10 months after my fifth surgery, results showed a suspicious abnormality. Suspicious abnormality, a rapid increase in diameter pa, then increase in the same mass. So nagkadako in the same mass. Then biopsy results confirm nga it's a ductal carcinoma in situ, commonly called as DCIS among medical professional. So, The only difference this time is my ductal carcinoma in situ is high grade. So I'm quite scared. Kaya I don't have any idea of what's it all about. Later, after, even though later na discuss na ni Doc, afraid gihapon ko because DCIS is considered non-invasive noon, non-invasive or pre-invasive breast cancer. According to some medical studies, ako ning basahon ha, ning unang medical studies, DIS is can spread outside the breast, ingon pa. DIS can spread outside the breast, cannot spread outside the breast, but it still needs to be treated because it can sometimes go on to become invasive cancer. What we mean by invasive cancer, pwede si jamukanat. So, in most cases, a woman with DISS can choose between breast conserving surgery or BCS and simple mastectomy. In my case, I chose to have a I chose to have a total mastectomy since there's a breast cancer history in my family from my father's side. So actually what I wanted that time is to simply ask my doctors, my surgeon to really work out on a total mastectomy. Because if it's minor, feel na ko nga basig mo balik pa, I'm quite afraid. So I asked my doctors to have it instead a total mastectomy. That's my seventh surgery, a major surgery under that time under ko o gitawag nga general anesthesia because my fifth my what we call this my sixth that was sixth yeah my sixth surgery considered to be a major surgery under a general anesthesia. Now, to make the long story short, after my total mastectomy, I followed every order for follow-up laboratory procedures. From after operation, after total mastectomy, I have to go back to Cebu for after 2 weeks for another laboratory exams. Then after that, 1 month later, then 3 months after, 6 months after, until my graduation after 1 year from operation from total mastectomy. Then after 1 year, after 1 year rather, I followed my regular annual mammography and high definition sonomammography. It was yearly after 2014, 15, 16, and by April of 2017, my radiologist and surgeon found out that there's a cyst in my right breast this time. Left man tong gikuha, but in my usual laboratory tanan, even though there is no more tissue, mammary gland or something like here in my left side, cover pa din sa examination. So it was April of 1917 that they found out that there's a cyst in my right breast this time, but simple cyst lang, and the previously seen solid mass nag-increase ang diameter. Beforehand, there's already a solid mass, but it's as small as very small lang. So, but the addition to that, as to the result, the current result, there is what we call simple cyst. Now, ang solid mass has increased in diameter. Then my doctor said, since you have a cancer history from your left breast, might as well go for further examination. I need to perform an operation in your right breast this time. So it was my 8th surgery. It was my no, that was my 8th surgery. Last May 10 of 2017. But this time, it's not the usual minor surgery nga akong na-experience. This time, the only difference, kanang move forward ta sa sa 8th surgery na ako. This time, ang gi-perform sa ako is what we call a core needle biopsy. I still have to undergo a local anesthesia in a minor operating room. A core needle biopsy is an operation done by a surgeon uses a hollow needle to take out pieces of breast tissue from a suspected area. Then the doctor has felt or has pinpointed on an imaging test. A result came in negative after the procedure and is benign but needs an interval follow-up yearly to monitor if there is a progress or none. Now, that was in May 13, 2018, mammography and high-definition sonomammography nag-perform na pod until now. Though there is still, according to the result, there is still an obscured isodense mass in my right breast that is regularly monitored by my doctors. Now, after that core needle biopsy, munang maingon ko, this is the point in my life that I need to be prepared all the time. Lifestyle check all the time, and always follow up doctor's advice. There is nothing to be afraid though. So to those people who are out there who are afraid rather in the same and with the same situation as mine, please don't lose hope. Just continue to live the way you used to be, but this time just take note of your intake, your lifestyle in general, and of course follow your doctor's advice. You know what, in my case, there's no radiation, there's no radiation therapy, and no chemotherapy. As in none at all. Waya, not even one laboratory performed after the total mastectomy, except for the usual mammogram and sonomammography. That was I thank God every day for, despite all these medical concerns, I'm still alive and healthy. I know this is just trials from God. And I know nga makaya na ako ni as long as I live with my family. And as long as I always put God on top of my everything. I'm not a very religious person, but I feel the care, the second life that He gave me. Now, to cut it off, being a survivor, my secret is always to live according to the glory of God. And good lifestyle, as much as possible, a good diet, and a regulated amount of meat intake, especially the red meat. I do away no red meat, a portion of pork only, then a lot of organic fresh vegetables or fruits, and good amount of fish every day. Chicken is good also because it's white meat. But make it sure dili sad permanente. Regulated amount intake gihapon. And then my barley juice 30 minutes before breakfast. That's what I practice since total mastectomy. No stress if possible. As a teacher, I know there's a high percentage of stress due to most of the time, our take-home work. But I always make it to the point that there is always minus the stress. Ingon pa sa akong mga friendship, Kevs sa stress. Laban Japan. Always. Meaning, I don't have to take it seriously. I mean, the stress from my work, because my work is my life at the same time. Now, if you really wanted to know about my lifestyle as a breast cancer survivor, just please follow me and watch my upcoming videos. And please don't forget to like, subscribe, and share, and click the notification bell for more uploads, latest updates about this journey, and my other lifestyle as well as a farmer, a teacher, a mother, a professional, and among other things. Thank you.